Good morning. Welcome everyone to October's ISCRR Learning Series webinar. My name is Kim Pham and I'm the Acting Co-Director for the Institute for Safety, Compensation and Recovery Research, ISCRR for short. Today I'll be opening and closing the Learning Series webinar and fellow ISCRRite Dr. Jimmy Twin, our Research Communications and Translation Manager, will facilitate Q&A. Firstly, I'd like to wish to acknowledge the people of the Kulin Nations on whose land many of us are based today. I pay my respects to their elders, past and present, and we extend that respect to First Nation peoples that are here online today. Also, as part of Monash University's commitment to contributing to the process outlined in the Uluru Statement from the Heart, we look forward to a future where Indigenous and non-Indigenous Australians walk together towards a fair and truthful relationship and create a vibrant and prosperous future. Welcome all. For those who are new to ISCRR's Learning Series webinars, we present on a variety of areas, including topical areas of research, the impact from our research, and also best practice management of research. You can find out all about future ISCRR events by joining our mailing list through the evaluation survey that will appear when you leave this session. Our topic today, workers' compensation and head trauma in professional sport. What happens next after the Senate inquiry? Now, last month on the 5th of September, the Senate inquiry into concussions and repeated head trauma into contact sports were handed down in a much anticipated report. In this webinar, we have Dr. Eric Windholz from Monash University, who will examine the current insurance arrangements for athletes, the exemption for workers' compensation for professional sports persons in particular, and the options for reform in light of the Senate inquiry's 13 recommendations as part of a national strategy to reduce concussions in contact sports. Dr. Eric Windholz is a senior lecturer at Monash University, formerly General Manager of Strategic Programs and Support at WorkSafe Victoria, as well as former General Counsel with WorkSafe Victoria. Eric researches in the area of what he describes as the science and art of modern regulatory practice. He has written and presented extensively on the application of worker health and safety law and workers' compensation into professional support. Eric appeared before the recent Senate inquiry into concussion and repeated head trauma in contact sports. And he's been quoted extensively and cited in this report as well. A warm welcome to Eric. Now over to you.
Thanks very much, Kim. And if everyone just bears with me, I'll get my the PowerPoints up. As I'm just bringing the presentation up though, let me just thank Kim and thank ISCRR for inviting me to give this presentation on what I think is a very important issue. It's an important issue not just for sport because of the prevalence of concussion in sport, but it's also, I think, important because it tells us something about the workers' compensation scheme and the universality of the workers' compensation scheme. The context of the webinar, as Kim said, is the recent Senate Community Affairs Reference Committee inquiry and its September 2023 report into concussions and repeated head trauma in sport. The inquiry was called in response to a growing number of former athletes and their families speaking about the impacts of sport-related concussion on them and their loved ones and what they perceive to be the lack of support from sporting organisations. The purpose of the inquiry was to explore the current evidence on sport-related concussion, the challenges encountered in treating and rehabilitating people with sports-related concussion, and what measures could be done to improve the identification, prevention, and treatment of sports-related concussion to reduce both their short and long-term impacts. The committee received 92 submissions. It heard from 84 witnesses across the spectrum from athletes, their families, medical and legal experts, and the major Australian sporting organisations and player associations, And as Kim said, I was one of the people that presented, that both made a submission to and appeared before the committee. The committee's report contains 13 recommendations. There are also 8 additional recommendations in additional comments provided by Senator Lydia Thorpe, who called for stronger action than the main committee. So what did the committee recommend? The committee's recommendations span the spectrum from prevention to treatment and rehabilitation and return to work. They explore, or they have recommendations calling on sporting organisations to explore rule modifications and changes to policies and procedures to prevent and reduce concussion incidents and head trauma incidents and improve community awareness and education. There are recommendations for the development of guidelines and increased training on treating concussion and head injury, and recommendations calling on government and medical experts to develop return to play protocols which could be adapted across all sports. You'll see on the PowerPoint that I've used the term return to work and not return to play, which is the term used in the report and amongst the sporting community. This is deliberate. For professional athletes, and that's the focus of this webinar and my talk, sport is their work and they are workers. This is a theme I'm going to return to throughout the presentation. Underpinning these recommendations are calls for more independent research into the short and long-term effects of concussion and repeated head trauma in sport, and calls for better compensation and support to current and former players. And it's on this final recommendation that I'm going to focus in our time together. So what did the committee find about existing compensation and support arrangements? Well, simply put, the committee found them to be deficient. With respect to support provided by sporting organisations, the committee acknowledged that these have improved over recent years, but nevertheless concluded that they were inadequate. The committee noted that contractual injury payments, such as for lost income, the cost of private health insurance, and covering any medical gap payments, usually only last for the duration of the player's contract or maybe a short period thereafter, and that post-career hardship funds were discretionary and limited in their application. The committee also noted that supports varied according to the financial resources of the governing body, the level of competition, and the bargaining power of the athletes, with disparities particularly between male and female competitors and also between full and part-time athletes. The committee also noted that there is private health and temporary and permanent disability insurance, but that these too have limitations. Not everyone takes them out or maintains them post-career, and coverage and eligibility rules, which vary from plan to plan, can exclude players that are suffering from concussions, head traumas, and other long-term debilitating injuries. The report also considered compensation through the courts, through litigation, but concluded that there are significant barriers to recovery that render litigation both speculative and suboptimal. And that these inadequacies mean that athletes often have to resort and rely upon Medicare, NDIS, and other government supports to deal with the consequences of concussions and head traumas post-career. The report acknowledges, though, that affordable and timely support through these avenues is not guaranteed. And it's in this context that the report acknowledges the exclusion of professional sports people from workers' compensation. It is not one of the government supports that is generally available to them. A situation the committee describes as unsatisfactory and inequitable, and something I will return to. So what did the committee recommend? The committee's main report and Senator Thorpe's recommendations are shown. The differences reflect the majority committee's cautious approach, which contained much encouragement but contained few concrete calls befitting what they labelled as a significant public health issue, and Senator Thorpe's commitment to more radical action. As can be seen, the main report encourages state and territory governments to address the issue within the parameters of their state and territory workers' compensation schemes. Senator Thorpe, on the other hand, places the onus on the federal government with a call for a no-fault insurance scheme. In the time remaining, I'm going to focus first on the sports person exemption from workers' compensation schemes, and then I'll speak to what might be a pathway forward. Workers' compensation, as I think most people on the call, but maybe not everyone on the call knows, is a state and territory responsibility. While there is a national scheme pursuant to, that applies to Commonwealth authorities and corporations in competition with Commonwealth authorities, and entities can apply to self-insure under that scheme, sporting organisations do not satisfy the threshold eligibility requirements. So we are left with the state and territory schemes, which are similar but not identical. They differ in coverage, eligibility, in benefits. Sometimes in subtle ways, sometimes in more obvious ways, but nearly always in important ways. And they all have sporting exemptions, but with differences. And I'll come to these differences shortly, but first it's important to understand the rationale for the sporting exemption. They were introduced in the mid-1970s, a time of growing professionalisation of sport in this country, and in response to a series of decisions that found professional athletes at that time were entitled to workers' compensation when the prevailing industry understanding was that they were not covered. That is, there were cases that said athletes were covered by workers' compensation in circumstances where the sporting organisation had not taken out a policy for them. And this raised a number of issues and concerns. First was the spectre of potential personal liability of committee members to pay compensations and damages, a spectre that was heightened by sport governing bodies generally being unincorporated at the time. There were concerns about sporting clubs' capacity to pay insurance policies for high-risk activity, and there was also a perception at the time that sport was not work, rather it was play, and that footballers weren't workers, they were players. And the final justification at the time was that most players had private personal insurance cover in place. These factors combined to lead state and territory governments to carve out a sporting exemption from their workers' compensation legislation. Shortly, I'll return to these factors and assess their current relevancy. In the meantime, though, it's worth noting that at least in some jurisdictions, the sporting exemption was expressed to be a temporary measure. For example, in Victoria, the Minister for Social Welfare at the time stated the exemption would be for a limited period during which the practicability of introducing alternative schemes for compensating injured professional sports people would be examined. However, only New South Wales proceeded to enact bespoke compensation legislation for sports persons, the Sports Injury Act of 1978. And again, I'll come back to that shortly. But for now, let's look at the sporting exemptions. They're summarised on the PowerPoint. It's a busy PowerPoint, but as you can see, they vary from jurisdiction to jurisdiction. Most jurisdictions exempt from coverage injuries sustained by a person, or a worker, I should say, a worker, that is received while participating as a contestant in a sporting activity, training or preparing to so participate, or travelling between home and the place where the person will participate and train. Queensland, Western Australia and South Australia then add to that list injuries incurred while performing promotional activities. And then there are exceptions from the exemption. First, there are exceptions for certain occupations, most notably jockeys and harness riders, but also in some jurisdictions, boxers and wrestlers. Second, in New South Wales, Western Australia and Tasmania, the exemptions only apply if the sports person under their contract is not entitled to any remuneration other than remuneration for doing those things that are exempted. Those with long memories will recall that Victoria's workers' compensation scheme once had a similar exemption until the 2005 case of Whitehead and the Carlton Football Club. That case looked at the contract that Whitehead had, Whitehead being a footballer in the Australian Football League, and found that it included remuneration for engaging in promotional activities. And it found that remunerating for promotional activities rendered the exemption nugatory. In Victoria, the legislation was quickly amended to remove that exception to the exemption. Yet it remains in New South Wales and Tasmania, with the result that in those states, if the sportsperson contract also remunerates them for promotional activities, they may not be covered by the exemption. And third, the Northern Territory applies an income threshold such that the exemption does not apply to exclude professional players who earn more than 65% of average weekly earnings. The intention of this provision is to ensure workers' compensation coverage for professional players who derive a substantial part of their livelihood from sport. The opposite effect to the broad exclusion in other jurisdictions. And finally, reference should be made to New South Wales, the only jurisdiction with bespoke arrangements for sporting injuries, the Sporting Injuries Insurance Act of 1978. It covers registered participants of sporting organisations who have chosen to be declared under the Act. Compensation is very limited, however. Coverage is only for death or permanent loss of arms, legs, sight, hearing, and mental capacity, and benefits are only paid in lump sums according to a table of names. There is no provision for income support or payment of medical expenses. Importantly, in New South Wales, sporting organisations have a choice to opt out, either by having their declaration revoked and returning to the workers' compensation scheme, or being granted an insurance exemption if they can satisfy the relevant authority they have adequate private insurance. So in conclusion, what can be seen from this table is that the exemption for sports persons is complex and it is not absolute. In those jurisdictions where sporting or athletic activities are covered, the employer of the sports person or athlete is required to take out an insurance premium and pay an insurance policy and pay premiums. So how much does it cost to take workers' compensation out for these sports persons? Comparatively speaking, it does not come cheap. Sporting activities have the highest industry rates in New South Wales, South Australia and Tasmania, and even in Victoria, where it is not the highest rate, it is still significantly higher than the average of industries we normally associate with high-risk activities such as construction and meat processing. I also have shown New Zealand that has a universal no-fault accident compensation scheme. Sporting activities have the highest premium rates there too. So where to from here? The Senate's committee's report makes clear that existing insurance arrangements for professional sports people are inadequate and inequitable. It has a call for action. The state and territory governments engage with professional sporting organisations to explore removing the general exclusion of professional sports people from their schemes. Beyond that, though, there is little by the way of concrete suggestions. It does, however, raise a number of questions or issues for consideration. First and foremost is whether the sports person exemption from workers' compensation should continue. What is its rationale today? If we return to the arguments advanced for it in the mid-1970s, do they continue to have force? First, with the spectre of potential personal liability of committee members, a spectre that heightened by sporting bodies generally being unincorporated at the time. However, today, and almost without exception, sporting bodies are incorporated. The change in the factual matrix renders this rationale for exclusion redundant. Another justification was a perception that sport is not work. However, today, professional sports people are recognised as workers and employees. There is High Court authority to the point, with the result that the full panoply of labour law, commercial law, and other forms of law relevant to employees applies to professional sports people. From obligations to pay income tax and superannuation levies, to statutory work health and safety obligations, to the doctrine of restraint of trade. Outdated notions of professional sport is not work and professional sports persons are not workers no longer provide justification for their exclusion from workers' compensation. And nor do sports high risk of injury or even a sports person's consent to that high risk of injury. They also, in my opinion, do not constitute valid grounds for exclusion. Workers' compensation schemes originally were designed to cover and continue to cover workers in high-risk industries and occupations. The exclusion of professional sports persons on this ground runs counter to the raison d'etre of workers' compensation schemes. A high risk of injury is a more compelling reason for inclusion than exclusion. Imagine excluding mining and construction workers because their places of work were too risky. This brings us to the incapacity of sporting organisations to pay premiums. With sports corporatisation and professionalisation has come commercialisation and financial rewards. Some professional Australian sporting codes today measure their revenues in the hundreds of millions of dollars. For them, the issue of capacity to pay no longer arises. But the emphasis in what I just said was on the word some. Not all sports have shared the spoils of commercialisation. Country clubs, female codes in particular, do not attract large amounts of revenue. They may have capacity to pay issues, especially given the high premiums we saw previously. But is this a valid reason for an exemption? Workers' compensation schemes do not exempt other struggling businesses, let alone provide a blanket exemption for all employers, regardless of revenue. And the final exclusion or justification for the exclusion was most players having alternative insurance arrangements in place. And the inadequacies of these have already been discussed. This brings me to the conclusion that there is little today by way of rational principle for excluding sports persons from workers' compensation schemes. However, that does not automatically mean that the best course of action is simply to return them to those schemes. The Senate report raises other questions. All right, I just realised my clicker wasn't working. Is there a need for a bespoke scheme? What type of injuries and loss should we be compensating? On whom should the responsibility and cost fall? And what about other sporting communities, amateur, social, children? With respect to the last point, the other sporting communities, there are really important issues to be discussed there. However, that's not the focus of today's presentation. I'm going to be focusing on the professional athlete, the worker. So let me have an attempt at answering some of these questions by proposing a pathway forward. And in doing so, let me start with some starting propositions. First, professional sports people are workers. Two, as workers, insurance and compensation arrangements for them should be no less than that provided to other Australian workers, and they should provide long-tail coverage for concussion and other long-term and long-latency injuries. And third, the nature of sport, the number and frequency of injuries, the speed with which sport calls for them to be treated, suggests workers' compensation schemes may not be fit for purpose. Therefore, in my opinion, we are looking for a bespoke scheme tailored to the unique circumstances of Australian professional sport. So what might a bespoke scheme look like? First, I think you need to differentiate between during career and post-career coverage. During a sports person's career, I believe that private arrangements should continue to prevail, a mixture of contractual injury payments and private insurance. Sport needs the speed and flexibility they afford. Also, that professional players should be covered by top-level private health insurance is highly desirable. However, I do not go so far as to recommend that government mandate sporting organisations to provide that insurance. I believe it is best left to the contractual negotiations between sporting organisations and player associations, noting though that this will, as is currently the case, mean that insurance and compensation arrangements will vary according to the financial capacity of the sport and players' bargaining power. This invariably will mean insurance arrangements for players competing in sports with less revenue, which are often females and part-timers. However, sports persons with less bargaining power should be protected by a state-sanctioned safety net, and workers' compensation can be that safety net. This can be achieved by creating an opt-out mechanism whereby sporting organisations can opt out of state and territory workers' compensation schemes if they can establish to the satisfaction of an appropriate regulator that they have suitable alternative insurance and compensation arrangements in place. Precedents exist around which such a scheme could be built. For example, state and territory workers' compensation schemes for employers provide for them self-insuring their workers' compensation claims. And this also could occur at a national level. Self-insurance is available under the National Comcare Scheme. This could be extended to sporting organisations, as could the entire Comcare scheme, providing a national workers' compensation model for national sporting codes. Post-career, where the employer-employee nexus is severed, a workers' compensation style scheme could apply. There could be an employer premium, government underwriting, with an outsourced claims management, maybe to specialist agents. Working out the details of such a scheme would require significant work, including, amongst other things, and as the committee itself envisaged, determining the financial impact such a reform would have on the various sporting organisations. And all of this would require a significant amount of data to risk rate sports and their risk management processes to establish premium rates. One thing that would assist in this regard, and I believe would be an important element of any scheme, would be exit screening of athletes. This would facilitate the early identification, intervention, and management of potential high-risk claimants. Better management would reduce costs, reduce premium, and reduce the risk of litigation. The scheme would need to be overseen by a government, maybe workers' compensation authority or authorities, if administered at a state and territory level. And there is also potential to link self-insurance to the Australian Sports Commission, which its recognition of sporting bodies and as a criteria for support from the Australian Sports Commission, thereby leveraging the Commission's role as the lead government agency responsible for supporting sport and building its governance capability. So these are what I presently envisage are the building blocks of a bespoke scheme. But I also must admit that my thinking evolves every time I speak with someone, and hopefully will continue to evolve as a result of the Q&A session that is about to follow. For this reason, though, the sooner we create a process to formalise and structure these discussions, the better. So let me conclude with a call of action of my own. Here is my email address. I would be pleased to hear from anyone interested in continuing the discussion and working on the pathway forward. And of course, any questions. Thank you.
Thank you, Eric, for that great presentation. Anyone who has any questions are welcome to post them in the webinar chat or using the Q&A function. To start off this conversation, may I ask Eric just to stop sharing your slides so we can see your face easier? That you've already covered this, but it's more just to re-emphasize your points that why is this such an important issue?
I think it's an important issue, I think culturally, because sport is such an integral part of our society. It's such an integral part of our cultural identity. Athletes are incredible role models. So both in terms of how we manage the sport and how athletes manage themselves has a great cultural significance. Many sporting legends are built around athletes who compete through pain, who compete at great personal cost. So how we deal with concussion and whether we allow players to continue to play with concussion has incredible significance. And all of this filters down to the amateur level, the social level, and particularly to the children's level. Every kid wants to be their sporting hero. So I think there is a cultural significance to the issue and what it says about us and how it flows down to children's sport in particular. But as I said, I also think it says something about us as a society. One of the great civilizing things that we have in our society is that we have a set of laws that require employers to take reasonably practical measures to protect health and safety at the workplace. And we have a set of laws that are designed to rehabilitate and compensate people who are unfortunate enough to be injured. And there is a universality to these laws, with one glaring exception. Sports people who are employed are exempted. And so I think it says something about the scheme and the universality of the scheme as well.
So we have a question that's just come through that from one of our audience, that have there been any approximate costings on what an insurance scheme would cost codes? How viable is that for lower funded sports?
There is not any robust costing that I've seen. And I think one of the things that was interesting about the Senate inquiry was that sporting organisations didn't share the cost of the schemes that they're administering. So there isn't the costing done, and that's why, as I said in my comments, there's a significant amount of work to be done, and a significant amount of data to properly risk rate sports and different sports, their risk management processes. With respect to the lower level sports, as I said, their capacity to pay, I accept, would be not as strong as the larger sports. But we also do know that, you know, part of insurance is pooling and pooling risk. We also know that through the workers' compensation schemes, that there is a knowledge transfer from better managed employers, or employers who have the resource to invest in health and safety and compensation rehabilitation, and there is a sharing of knowledge down to other organisations. But all of these things would have to be worked through.
Thanks for that, Eric. Another question that's come through. So talking about recommendation 1 is to establish a national sports injury database. Do you think this should have mandatory reporting around concussions at all levels of sport, or what other sports should be included?
Look, I think that some form of mandatory reporting would be useful. But it's got to be reporting for a purpose. Obviously, there is a research purpose for the health and medical community to get a better understanding of the prevalence and being able to track changes in prevalence. So there is a purpose there. If there was any form of statutory compensation arrangements attached to this, then reporting would be important for that. But I think the first thing we need to do is get the data. So much of this is anecdotal. Individual sports have data, but I suspect that the quality of that data will diminish as you work down from what I call the elite sports and you work through the hierarchy of sports. But I would support mandatory reporting.
Do you anticipate more litigation of sports injury post this inquiry?
Interesting question. I think that there is already some class actions that have been brought against the AFL. There are class actions either brought or mooted against the NRL. And I think you could expect litigation to continue for sports, for combat collision sports, but from a historical perspective. I think these will be claims being brought by athletes maybe a decade plus ago. Because sports have improved their management practices recently. And so I think today, the chances of litigation today are much less than the chances that they were in the past. But I would also say that often litigation is the last resort. It's a choice of athletes who have exhausted every other avenue. And if we don't put in place better avenues to compensate and support our athletes, then there will be a cohort who feel they have no choice but to bring litigation. And there will continue to be law firms who will support them through a no-win, no-fee basis to bring that litigation. So I think that you would have to, you can't discount the possibility of litigation, but the barriers to successful litigation, which the committee itself talks to, those barriers only increase in time as sports implement better management practices today.
Thanks for that. So there's a lot of comments coming through in the chat and questions. So thanks for that. We will endeavour to answer as many questions as possible. Any large scale questions that we can't cover here, we might ask Eric for further comment post webinar. Given the I'll just look at the next one that's come through, that given the well-known issues with workers' compensation schemes and patient outcomes, would there not be an argument for improved access to all, including professional sports people for support and management of MTBI? Does a national registry act as a starting point then? Looking at dedicated concussion clinics, increased rehabilitation access and services for MBTI and long-term support?
Look, I think the answer is I think all of that is desirable. Absolutely desirable. I think, though, the starting premise of the question, if I remember correctly, was about issues within workers' compensation schemes and their ability to provide, I think, the timely support and the comprehensive support, or at least in a timely manner. And as I mentioned in my presentation, I think the nature and frequency of injuries in sport are such that I think current workers' compensation schemes may not be fit for that purpose. And that's why you might need either some kind of tailored pathway. Many schemes have developed tailored pathways for traumatic injuries. It might be developing another pathway for concussion and head trauma.
So the average punter might be concerned with how all of this will change the rules in the sports that they love. Do you think sports will change significantly, or perhaps will athletes sign waivers at the beginning of their careers?
So let me break that into two parts. I think for some sports, concussion poses an existential threat. Sports are already modifying their rules to protect the head, to limit head contact. And if anyone wants to look at AFL or NRL today compared to 25 or 30 years ago, it is a vastly different sport. Arguably quicker, but also arguably less physical. Sports need to better manage this issue. And as I said, I acknowledge that they are better managing the issue. And I think the management today is so much better than what it was 5 years ago and 10 years ago. But I think sports will continue to evolve and change. But also, so will the practices, not so much on the field, but off the field, in terms of medical support, timely medical intervention. There are already sports that have taken the issue of withdrawing a player from the sporting field for concussion out of the hands of the club doctor and put it into independent doctors. So I think we can see a whole range of issues evolving. And Jimmy, I've got to apologise, I don't remember the second part of the question.
So looking at athletes signing waivers at the beginning of their careers.
Look, I mean, one of the arguments that is raised in litigation now is the defence of a voluntary assumption of risk, that athletes understand the risk that they're undertaking, and in effect they do sign waivers. A lot of athletes' contracts acknowledge the risk of engaging in the sport, but there's certain things you cannot sign a waiver for. So, for example, under workplace health and safety laws, a worker cannot sign a waiver accepting the risks in the workplace that it is the responsibility of the employer to reduce or eliminate. So there are limits to the extent to which waivers will be effective. They might be effective at the common law, but there will be limits.
Thanks for that.
And by the way, as I said, don't think that they're not being signed today, or at least an acknowledgement of the risks of the sport.
So one of your starting propositions to a way to move forward is that stating that professional sports people are workers. One could argue that this is quite a simple step forward. What type of resistance would foresee what would occur?
I didn't state that proposition today as being something radical. It was the proposition when the exemption was first put in place in the mid-70s. I think there is general acceptance today that if you are an athlete in a team-based sport, that you are an employee. But I think it is just worth stating, because once you say they're not a player but they are a worker, the question is, why aren't they then covered by the laws that apply to other workers? So in some ways, it might be stating the obvious, but I think it's worth stating. I would hope there is no resistance today.
We have time for perhaps 2 more questions for today. So one that has come through, and so this will be really just reinforcing some of your previous comments. Do you think that the responsibility for setting up the appropriate insurance arrangements in each sport is on the sports governing body, player association, government, or other organisation?
The simple and maybe trite answer is to say all of the above. But I think somebody's got to take the lead. And I do think that government is the body that needs to take the lead and at least create the forum for the discussion. But ideally do that in a way that is done collaboratively with the sporting organisations and the player associations, and indeed the medical community and the legal community as well.
And looking forward, what do you think are probably the next best steps? So given our audience today ranges quite widely from government organisations from various different jurisdictions around Australia, sporting associations, academics and the general public, like where to from here?
Probably in a very self-interested way. I would say that we need to do more research on this. But I do believe that the call from the main report of the Senate committee was to state and territory workers' compensation regulators to engage with the sporting community to work out whether this is an issue of simply removing the sportsperson exemption or something more. I ideally, as I said earlier, would like to see government take the lead. I'd like to think that the state and territory and indeed the national Comcare regulators would get together and maybe commission an interested researcher to do some work on it.
I might just squeeze one final question in before we close off today. And I think this will be a nice wrap up, that you mentioned this is a significant public health issue. And so perhaps it would be good to talk about how significant is this issue and to reinforce how it compares to other professions.
Well, if we just look at the workers' compensation premiums for those sports persons who are covered by the scheme, we see that it is a significantly higher risk. So it is a high risk for the proportion of the population that engage in sport. And we also know that we are a sport-loving country and we have a significant proportion of our population that engage in sport. I don't have the exact figures in front of me, but it's a large number. So it's an issue that is both, it has a breadth to it. And while a lot of the focus is on contact and collision sports, AFL and rugby in particular, there are other sports that also have high concussion rates that aren't necessarily obvious. And one of them is gymnastics. If you think about young people starting off gymnastics, tumbling, getting up on the beam, trying to, just even run along the beam or jump off the beam or do a tumble or on the uneven bars, unfortunately, a lot of them land on their heads. And when they first start off, they have lots of padding and lots of mats in front of them and to cushion the fall, but that doesn't always prevent the concussion. And at some point, the mats are removed. So this is an issue that is beyond the obvious.
Thank you, Jimmy. Thank you, Eric. That's really, really, really insightful discussion. Thank you, Eric, for your presentation. Good to see lots and lots of questions. It certainly, I'd say, highlights the complexity of the compensation and insurance arrangements between state and territorial jurisdictions, and also the differences between the sporting codes as well. I'd like to also thank you, Eric, for discussing how reform is needed to address the current relevant exclusions. And we really appreciate your ideas on the bespoke professional sports scheme, what it could look like, and the current gaps in data that we may have. For those that want to join the call to action, the collaboration and starting the conversation between governments, jurisdictions, the sporting community, please feel free to contact Eric or ISCRR. We'll leave the contact details in the chat. But really, thank you all to have joined us online today to hear from Eric. I'd like to invite you all to fill out a very short evaluation survey at the end of this session. Your feedback is really invaluable for allowing ISCRR to continue providing topics of relevant interest. Thank you again to Eric for your time, and to all here. Have a wonderful week.